Hi students, welcome to Learn Classic Education. Today we are going to read about Phimosis Reproductive System Disorder. Now phimosis. What is phimosis? Phimosis is the inability to retract the foreskin over the glans penis. It is common in young boys and often physiological. It becomes pathological when associated with scarring or disease. So it can affect urination and sexual function. So may increase the risk of infection if it is left untreated. You can see in the image, in the normal it appears like this. In the case of the phimosis, it appears like this. But the foreskin, it is unable to retract the foreskin over the glans penis. Now phimosis, types of phimosis. There are two types of phimosis, that is physiological phimosis and pathological phimosis. So physiological phimosis is normal in infants and young children and it is usually resolves naturally with age. Pathological phimosis is caused by infection, trauma or scarring and it requires medical treatment. Now coming to the causes of phimosis. The causes of phimosis are, first is congenital, that is it is present since birth. Then poor genital hygiene, recurrent infections, then scarring due to forceful foreskin retraction, diabetes mellitus and skin disorders. Lichen sclerosus is an example of skin disorders. So these are the some causes of phimosis. Then coming to the clinical features. First is difficulty retracting the foreskin. Then pain during urination, ballooning of foreskin while passing urine, pain during erection, redness and swelling. As shown in the picture, the swollen glans, constricted and swollen foreskin, and then constriction. Then recurrent urination or penile infections. These are the clinical features. Coming to the complications, first is recurrent urinary tract infections, balanitis, that is inflammation of the glans, paraphimosis, that is the foreskin gets stuck behind the glans, phimosis with urinary retentions, increased risk of penile cancer, that is rare, it occurs in rare cases, and pain and discomfort during sexual activity. Now diagnostic evaluation are detailed medical history, physical examination, urine examination if infection is suspected, blood glucose test if only there is diabetes is suspected, and culture of discharge when infection is present. These are the diagnostic evaluation of phimosis. Then management, how to manage. Two ways to manage: conservative treatment and surgical treatment. In conservative treatment, first proper genital hygiene should be maintained, topical corticosteroid cream should be applied, and gentle foreskin stretching exercises should be done. Then in the surgical treatment, first is circumcision. Then is perpetuoplasty, that is the foreskin preservation surgery. You can see in the image how it is done. Penis with phimosis, loosening the foreskin, skin retraction is the step 2, then the removal of the foreskin and fixation of the foreskin, then surgically corrected penis. So the nursing care is we have to access the pain and the urinary difficulty, teach proper genital hygiene, administer prescribed medications, monitor for infection, provide pre- and post-operative care, educate parents or patients about avoiding forceful foreskin retraction. So the summary is phimosis is the inability to retract the foreskin over the glans penis. It can be physiological in children or pathological in older individuals. Proper diagnosis and management helps in improving comfort and prevent complications. Conservative treatment is preferred in mild cases and surgical treatment is curative in persistence or severe cases. Education and hygiene play an important role in prevention and care. So this is all about today's session about phimosis. Thank you.